excited to be a part of this as well in my little part here. But like Nicole said, we have a variety of topics to cover tonight. And I will let each of the panelists kind of give a brief introduction of themselves as we get to it. And then the way this will work is each of them will talk for about 5 to 10 minutes, maybe a follow-up question here and there after each section. But then at the end, we really just want to open it up for open-ended questions, kind of a nice Q&A. But I want to give them the time to talk. I know we have at least one person who may have to leave early. So I think for me, I will go ahead and pass it on to Tan.
All right. Thank you, Chad and Nicole. Welcome everybody this evening. So my name is Tanya Williamson. I'm a clinical exercise physiologist with the Health and Wellness Lab and have been working with Nicole for, believe it or not, like going on 13 years, Nicole. Whew. So prior to that, I had some experience in cardiac rehab and then some musculoskeletal rehab as well. So it all kind of applies within this population as we kind of work with different individuals with different chronic conditions along the way, but certainly seen a lot of different cancer survivors and those living with cancer along the way in my time. So my little brief presentation is about safety, individualization, and scope of practice. So safety first. I'm kind of the safety nerd in the lab, and I like to keep people safe first and foremost. And so within my role, I'm the project coordinator for ACE, Alberta Cancer Exercise for Calgary and Southern Alberta. And over the past sort of 5 going on 6 years that we've been conducting that research and program application, we have sort of practiced a lot of these things that you kind of learned through the week if you've had the pleasure of joining all week. Is a lot of the practice that we have is based on the research that's out there. We're a knowledge translation lab, and so we're really looking at sort of bringing what is being done and conducted and applying it within our programming and our research. So, so safety first is my first sort of few points that I wanted to talk about. So we screen all our individuals as they come into our studies and our programs. So we want to make sure that we understand what we're dealing with, because knowledge is power for sure. So we need as much information as we can get, and often that intake process of information is more valuable than even that sort of first fitness assessment that you do with people. So getting information about their cancer diagnosis, cancer treatments, any side effects they're dealing with, any chronic conditions that people are dealing with on top of their cancer diagnosis, and then of course any medications are all taken into account as we develop and prescribe exercise for these individuals. And so beyond that, it's an ongoing communication with our participants as they come in. So most of our programs and studies run for 12 weeks. And we require that ongoing communication each time we see them, each time we interact with them, right? So we need to make sure that exercise is being well tolerated, that there isn't any changes along the way to any of their treatments, there isn't any change in their diagnosis, anything like that along the way. So that ongoing communication and update within your scope of what you know about those participants is by far probably the most valuable thing that you can do. Once you have that information, you're armed with that information and you have to really move forward with it. And this is your moment to really tailor it and individualize the exercise for these participants. So we, even within our group classes, which most of our studies run that way, we really tailor to each participant. So you're going to consider each condition that you're working with each person, which can be quite complex, and really sort of make sure that that series of exercise or that program that day is going to be well tolerated. So for example, you're working with somebody who's diagnosed with breast cancer, who's on radiation, has known hypertension, is on medications for that, but also is dealing with knee arthritis. You're taking that all into account as you work with them. So, you know, you are going to tailor to make sure the exercise is tolerated for the knees. You're going to modify the exercises if their fatigue is high from the radiation, and working within any sort of shoulder limitations that are going to be applicable within what they're dealing with from the breast cancer and radiation side of things. And then within the hypertension side of things as well, you're looking at sort of modifying exercise to help ensure safety and participation for that as well. So taking that all into account, if that's one of your participants, then you're adding that sort of that piece of the puzzle to the other 9, 10, 11, 12 participants in your class. So it really is important to consider all of that when you're coming, when you're approaching each class. So in having said that, what you really need to do is be mindful of what you're dealing with, be really well prepared, and be ready with modifications for your classes or for your sessions with your participants, and ensure that you have that sort of on the ready for them to be able to work with. I always take the opportunity to make sure that you also have a moment to educate your participants. So you're educating them on exercise, you're exercising them on behavior change, adopting exercise and physical activity to their life, and then of course just educating them on their chronic conditions as well. So anything that they're dealing with, whether it's the cancer diagnosis or the other conditions that they might be having, you take the time to really explain why you're doing things, why you're modifying them, and have that sort of teachable moment within your sessions with them. And then my last point there, stick to your guns, is just about, if you've taken the time to modify the exercise, make sure that they don't get caught up in the moment and want to try what everybody else is doing. If you want them to do an exercise a certain way, make sure that you sort of, stick to your guns on that, that you're doing your due diligence and keeping them safe by keeping them where they need to be there. So next slide is screen again. So when you're working with them, you're just, again, that's a sort of ongoing communication as you proceed through the time with them. So following up on stability of their medical conditions, any changes in treatment or medications, and tolerance of exercise. So again, you can still go back, ensure safety, ensure you're modifying and tailoring as you need to. If at any point you need to consider that things aren't going well, or things have changed, things have progressed, and you're sort of questioning whether this participant is sort of safe to be working with anymore, you need to really stop and sort of go and seek the additional advice from the exercise professional from the medical professional that they need to be considered here. So it might be a physio, an OT, it might be their physician or oncologist, it might be psychology, or if you aren't a CEP and you're working with somebody that might be sort of in that, need that sort of scope of practice, then again, referring on keep within your scope of practice. So if you aren't a CEP, refer on to those that would be sort of applicable to work with that participant. And then my last point is about, this is your moment to really sort of brag about what, if you are a CEP, what is a CEP, right? Often we get asked, are you a nurse? Are you a physiotherapist? Or, what are you? And no, we're a clinical exercise physiologist, and we come with this amount of education and these amount of certifications, and we have this special knowledge to apply within this scope of practice. And so I find it's really valuable to educate your participants about that, so they know who they're working with, and then from there, we can, hopefully grow the profession and sort of recognition within the field as well. And then as well, my last point there is if you're seeking clearance, or if you're speaking with any other healthcare professional out there, this is also your moment to really sort of educate them on who we are, what we do, and what our scope of practice is. So again, through my experience with ACE, I would say that I've really had the opportunity to connect with physicians, oncologists and whatnot, to potentially get further clearance, medical clearance for our participants. And so, for years on end, we used to send clearance letters. Jess can probably speak to this as well, about, we'd be dealing with people with advanced cancers, metastatic cancer, things like that. And we would be nervous about working with these people. And we were really looking for some specific guidance from the physician on how to work with these people and restrictions and things like that. And we would send these letters and they'd send it back and they'd say, no restrictions, unrestricted physical activity. And we'd be like, no, we don't want unrestricted physical activity. Actually, we want some restrictions here. We want to know like where our limitations are with these people, because we know intrinsically from a clinical perspective that there are and should be some restrictions. So I think there's a spidey sense and a sort of gut instinct that you should stick to. And if you get some letters back or clearances back that are saying no restrictions on unrestricted physical activity, question that. And so I've sort of approached things differently. So I've sort of approached my clearance letters as, hello, this is who I am. This is my scope of practice, sort of that moment to educate them. And then I'm aware of your patient's condition in this status. I'm wondering if from your perspective, they are medically stable to participate in this. Describe what you have planned. And then from there, really sort of, I often provide some type of guidance. So recognizing that they have bone metastases, I am going to avoid these types of exercises. Do you have any additional guidance or recommendations? And so that's how I tend to approach kind of getting clearance, if you will. And more often than not, people will sort of be sort of mindful of that and sort of recognize, oh yeah, that's great, I agree with that. And you kind of have that opportunity to sort of solidify that number one, we know what we're talking about, we're understanding, and then really we're kind of looking for that sort of level of expertise back from them on sort of what is needed for this participant.
Very cool.
Yeah.
Thank you. I do have a quick follow-up, and it's kind of along those lines of that communication with the healthcare professional. Do you think over time you've seen that improve with the communication with the healthcare professional? And if so, or if not, do you have any thoughts on how we can improve that line of communication? Because I mean, this whole, the 10 minutes you've talked, it just kind of shows the versatile role of a CEP, right?
Mm-hmm.
And so it's just kind of like streamlining that.
Yeah, for sure. So, I mean, I think that's what I have learned is that, the more knowledge you can express to them that you know about their patients, number one, that you know about exercise, and that you sort of are aware of sort of from your perspective on what you would suggest, then you can really kind of propose to them that they sort of have that confidence back in you, right? And so, again, I would say that's really, I really had to change my approach, and I was way more successful when I changed my approach on sort of, getting that additional feedback and clearance and whatnot. And yeah.
Awesome. Well, thank you.
Thank you.
All right. Well, we will move on to our next panelist, which I believe is Nicole.
It is. You are correct. Thanks, Chad. So hi everyone, my name is Nicole Struthers. I'm also a CEP with the lab, Master's in Kinesiology and a certified health coach. And so one of the things that we've noticed as we've kind of been working with our participants and developing programs, as well as kind of mentoring a lot of the upcoming exercise professionals in kinesiology, is this tendency to want to reinvent the wheel, get creative, come up with a fancy new program, instead of focusing on the basics and building a strong foundation. So now I know a lot of you guys are exercise professionals here, and so you understand the importance of this. But we had one specific example that we've kind of been working through the last half a year that we wanted to highlight. So with this, as exercise professionals, we want to meet our participants where they are at, even if it's boring for us. I think sometimes we get bored of teaching the same squat all the time, but the exercise is not about us. It's about our participants. It's about helping them where they are and increasing their stamina, their strength. So our programs don't need to be complicated to work. Often, if it gets too complicated, we lose the benefits because people get confused, technique falls apart. And so it's really about the consistency of movements. That's where we see a lot of the benefit. So you can see the two examples here. The first one is that basic chair, sit to stand, right? And touch your bum to the chair, sit up. It's a great one just for teaching squat technique. Now on the bottom, we have this Bosu single leg squat. So adding a few different elements, a little bit of a balance challenge. And so we do not recommend that. So Chad, you can hit the next button. There's an X through that just to kind of show the difference, right? As we're doing a lot of our building a strong foundation, working on the basics, we want to continually remind participants of the basics. So if you were here on Monday, Loren talked a little bit about that chemo fog or that brain fog that a lot of our participants come in. And so again, the same thing, like we get bored of hearing our own voice sometimes, especially online, and you're constantly reminding people to breathe, to engage your core, stand nice and tall. But I think I go through the exact same little mantra almost every exercise because people need it. And I hear people tell me all the time as well, like, oh, thank you for those little tips. Like that is so important because I forget about that. They forget how to breathe in an exercise. And so don't underestimate the importance of these basics. So the example that I want to walk you guys through is on the next slide here. So Chad, you can hit that. It's an example of just core regressions. So one of the things that we have been finding over the last couple of years is that even at the end of our 12-week programs, we still had a lot of people with really poor core form. And so we would coach them through the exercises, but their form would be awful, or they still experienced a lot of lower back pain, a lot of like extra like hip stuff. And so like, man, something is just not working here. So we went back and looked at how we were teaching our core at the beginning. And we did teach that this is how you need to activate your core, but we kind of blitzed through it and then would progress on to harder core exercises. And so we really regressed our core significantly to teach proper transverse dominus engagement and pelvic floor activation. And so we really have a whole little set program to build up that engagement. Now, if you come across participants who are like, oh, I know how to engage my core, and you can see that they're not, you can give them this example. So I'm going to use my husband because he's not here to defend himself. He is in his 30s. He is super fit, super strong. Like rectus abdominis is strong, right? So that's your six-pack abs for those of you who don't know that. He's been active, played sports his whole life, yet he still struggles with back pain. Okay, so he's gone to physio, to chiro and stuff to kind of help with that. And it turns out, lo and behold, he is not even close to engaging his transverse abdominis. Okay, so here's someone who's fit and healthy, who is not able or not using his transverse abdominis to stabilize his hips and to prevent lower back pain. So take it into our clinical population. A lot of our population has had different abdominal incisions. They've had hysterectomies, prostatectomies, different uterine and bladder cancers, right? Where a lot of those surgeries have incisions in the abdominal muscles, or even tram flap surgeries, right? So breast cancer reconstruction. Now, these people are not going to be able to engage those TVAs without really basic gradual steps. It takes time for our brain to reconnect to those core muscles and to start to feel them and activate them properly to engage and stabilize the hips. And this translates to all of our other exercises. So on the slide here, you can see kind of just the core muscles. So our core muscles are all of them, right? We have our transverse abdominis, which is on the side, our pelvic floor that runs underneath at the bottom of our spine, our diaphragm, which is going to work everything together. And then you have your classic like six-pack abs, your rectus abdominis, and then some other ones on top, like your obliques. And so we really want to teach people to engage all of these to work on that stabilization aspect. Now, since we've changed it, we've had such good feedback on the core regressions. So there's a quote from a participant here saying, "I'm so glad you're running this program. I love it so far. This is the first place that talks about proper core that is not physio, and I am so grateful for this." And so that's just one example. I know all of the other CEPs have examples as well of just appreciation for this and how important it is for our participants. I had one participant in one of my programs right now, and her goal was to feel her core. She can now feel her core, which is huge, right? So don't underestimate the importance of this and building that strong foundation. That's kind of my little tips.
That's awesome. Thank you. When I was studying for my CEP exam in the States with the American College of Sports Medicine, I don't ever recall seeing much about core regressions and kind of building that foundation. And I don't know how it is in Canada. And I don't think I missed anything because I passed the exam. So with that, do you know of any really good high quality resources that maybe we as CEPs and qualified exercise professionals can refer to about something like core regressions?
Yeah, what I've actually done, so we've created a whole document for our team and for our participants that we hand out, but I've gone more to physios because I find that a lot of exercise professionals are really good at the advancements and the harder progressions, but not as much on the regressions. And so we literally start feet flat on the ground, and you're literally lifting one foot up at a time, or even just focusing on breathing. So matching your breathing to your core engagement. And so a lot of that comes from physio. And so there's great like blogs and stuff online. So you can look up kind of how to engage transverse abdominis, pelvic floor, etc.
Awesome. Very cool. Well, thank you, Nicole.
Thanks, Chad.
All right. Moving on. Oh, hang on real quick. I believe next we have Jessica with a participant-centered approach.
Oh, I was like, woo, where's my cancer continuum? But then it popped up there. I'm Jessica. I'm another CEP in the lab. I actually started out as a volunteer, the very first volunteer training I went to when the Thrive Center started. And I was in the middle of my Master of Kinesiology program. And then I went on to do one of my practicum placements in the lab with Nicole. And I fell in love with working with this population. And then Nicole hired me on, and that was like 10 years ago. So I've been here for a while, minus a couple mat leaves. But I'm going to talk about our participant-centered approach. So we really focus on the participant in our programs and really educating them on listening to their bodies and doing what they can that day. And a lot of how we do that is through using fatigue and energy and rating of perceived effort scales. So Chad, if you could just pop down to the other slide there. So these are some of the scales that we use. So we'll educate people on these scales to start with, and then we'll use them throughout our programs. So you can see on the right there, there's fatigue and energy. And so getting people to rank where their fatigue and energy is at before they start. And then we get them to do it again after the session. And then we also get them to think about how hard the session was for them. So I'm just going to start explaining that piece of it. So just head back to the cancer continuum slide there. So we keep those in mind throughout the whole cancer continuum. And as you've heard throughout the week, it's beneficial and it's great for a person with a cancer diagnosis to be exercising throughout that entire cancer continuum. So pre-treatment, we heard a lot about that one in some of that prehab talk, where we're really trying to get those people to work on their fitness before they're going to be starting their treatment. And also, sorry, just gonna look at my note here for a second. Oh, the muscle memory, and then also just building some of those physical activity habits before they actually start the treatment and get hit with the side effects of the treatment. And then once we're in the treatment phase of this cancer continuum, this is where we see a lot of our participants in the program. We generally will often see them start with us here in this treatment phase. So that includes like surgery, chemo, radiation, sort of any of those treatments. And so in this particular phase, we're really trying to get them through their treatment with sort of minimal side effects or minimal impacts from the treatment. And so for here, we're really educating them on working where they're at or exercising, being active that day of where they feel they can that day. So that's, really big on our patient-centered or participant-centered approach in that treatment phase there. And then moving into post-treatment, this is where we can maybe push them a little bit more as they're starting to, maybe recover from some of those treatment side effects. And so we might be able to get them to sort of progress a little bit more through the exercises. And then, sorry, losing my train of thought here. And then moving into survivorship, that's again where we can really progress even more and have them, play with their effort levels. Sorry, I'm completely losing my train of thought here. Let me just check my notes here for 1 second. Yeah, and then into the advanced cancer phase. This one is a really unique one in that we're really trying to focus on their quality of life and being able to do their activities of daily living and just maintaining as much energy and function as they can in this particular part of the cancer continuum. It's a really difficult spot for them to be in. And so we're just trying to make that time frame for them as good as it can be. So that's just something to think about there in the advanced cancer care part of the continuum. So like just really thinking about it being patient-centered, teaching them to listen to their bodies. So we're not pushing them. This isn't a, give it all you've got type of scenario in our classes. It's not boot camp style. It's really having them listen to what they can do, providing them with modifications if they need it, and having them know that it's okay for them to be doing something that's different from what everybody else might be doing in the group. And then, yeah, I think that was most of the things I wanted to say. Sorry, I can't find my words today very well.
All good. I wanted to follow up on kind of like the modifications and your experience, these kind of, I can go to the next slide, using these scales, these are kind of like daily check-ins, right? And so someone that comes in one day and is feeling really good and kind of like crushes your workout, and then maybe they come in a couple of days later and it's not going well at all. So do you have any examples of kind of like in your experience, how you maybe have modified a specific exercise for someone from even in the same week or from one day to the other?
Yeah, actually, that's a great point and a great reminder of one of the things that I wanted to talk about was the idea behind exercise should be enhancing their life. Or if you want to talk about it as physical activity, you don't necessarily have to use the term exercise, but it shouldn't be taking away from their ability to enjoy the rest of their day or the day after, and, you know, spend time with their family or friends or whatever other activities they have. The exercise should be, you know, potentially giving them a boost of energy, allowing them to get through the day and not causing, you know, a tremendous amount of fatigue where they're then, you know, skyrocketing on that fatigue scale and then having to nap for several hours, or they can't even stay up to have dinner with their family because they're too fatigued from it. And so that's when we would really spend that time. I mean, we spend that time all the time, but we would really educate them on, you know, picking an intensity level on that RPE scale that would allow them to get that energy boost and not have a crash afterwards. And that would be, you know, immediately post, but also thinking about, you know, into the evening after their session and the next day as well. So yeah, really, you know, giving them information on the idea behind slowly progressing and then working up that tolerance, and that when they're, you know, in that treatment phase, we're not trying to improve their fitness. We're just trying to maintain what they have, and so that they're not seeing a bunch of declines during that treatment phase. And so that, you know, once they get out of the treatment phase, it's not this huge climb back up to getting to an activity level where they might have been before. And so, like, yeah,
kind of like what Tan said, it's kind of that constant communication with everyone. Yeah, absolutely.
Yeah,
well, thank you. All right, we'll move on now to talk about remote exercise delivery, and I will introduce Juliana.
Thanks, Chad. Oh, there we go. I just have one slide. So I did my undergrad at University of Calgary, had a couple of classes with Dr. Reed during undergrad, and then I actually went to Australia and did my master's in ex-phys there. Worked a couple of years there, and then I started at the lab at the beginning of the pandemic. So I have not had the pleasure of working with any of the programs in person, but I have helped develop and implement the Excel study with its online programming for the last year and a half. So I'm sure many of you have had some experience delivering exercise online or with telehealth potentially. So I'm going to spend a bit of time reviewing what our lab has done over the last couple of years, delivering exercise virtually. So when our team transitioned to in-person services online, the number one consideration, of course, was safety. So one essential element to our classes is we have a moderator in addition to our instructor, and this really allows our instructor to focus on teaching and demonstrating, so they're not trying to run up to their screen while instructing the class. They can just focus on leading, and they really rely on that moderator to keep their eyes on the screen at all times. So the moderator's role is to make sure participants aren't wandering off screen. Sometimes they don't realize where the view is. So making sure we can see them at all times, making sure their camera is on at all times. This hasn't happened too often, but there's sometimes when participants just don't feel comfortable having the camera on, but we explain that for safety reasons, we really do need to see them at all times. We make sure that they know that the instructor's pinned on the screen, so no one is watching them exercise. It's just the moderator and the instructor watching. And that usually alleviates most concerns. So in addition to the moderator, we do have protocols for any emergency situations. So our instructors and moderators always have access to a few different things. So they have access to participants' physical address where they're exercising. We know if the participant is exercising alone or if someone's in the house with them. We have a phone number of an emergency contact for each participant. And then we have a summary of their health information and any exercise modifications or considerations for each participant. And so I've been lucky with my classes. I haven't had any too dicey kind of scenarios happen, but I know there has been one class where there was a participant that wandered off screen and was gone for an extended period of time. And we did have to ask our moderator to call their emergency contact. Everything was fine. There was no issues. The person had to make a call or something, but it's just good to be safe than sorry. And it kind of shows why we need these different protocols in place, just in case. And so that's one thing to note, is considering the populations that we're working with. Some might be on treatment and they might be feeling really nauseous. Some might have nausea or bladder bowel issues and they have to run to the washroom. So just making sure that participants chat with instructors. Instructors know what their health history is. So making sure that they're communicating with participants and saying, it's okay if you have to run to the washroom, just give us a signal, give us a wave or something so we know where you're going and you're okay. So participants don't need to say it in front of the whole class. We can also use chat function on Zoom as another mode if they're able to just chat to us and let moderator or instructor know what's going on. And then communication. So communication is always important, but for online classes, it's so important. And, listening to one of the speakers yesterday mention how building trust with clients or participants is really essential. And how we do that online might be a little bit different. So even though we've been Zooming for around 2 years, it can still be really awkward. So there's pauses, there's people talking over each other. As instructors, we kind of just have to push through those awkward initial interactions and try to make people feel welcome, make them feel like they're in a warm space, try to facilitate discussions to really ensure that we're building rapport and that trust is created in those relationships. And then once you have that base of trust, we can start to think about how to create space if participants do need to disclose information. And this is where it's a little bit tricky online, because if you're in person, it's easy for a participant to kind of take you aside and say, hey, I have this update for my medical status, or we need to chat about something, I have a question. Online, we have to kind of get creative with how we do that. So all of our classes, we make sure that our instructors are logging on 15 minutes early, they're staying a little bit late if needed, and making sure participants know that's a time when they can jump on the call early, have a discussion with the instructors, talk about the exercises that they'll be doing in the class. And if that isn't private enough, making sure that they know that they can email us, making sure instructors have the ability to email after class as a follow-up, or potentially even have a phone call as well. So really, we just want to make sure that we're building the trust initially, and then we're creating that space and making sure participants know that they have ways to communicate with us so that we can really meet their needs. And then talking about communication in terms of actually teaching. So I'm definitely the kind of person that likes to have more tactile feedback, but that's just not an option teaching online classes. So we are really reliant on our verbal communication and visual cues when instructing. So I like to try to keep it simple, as Nicole was saying. So just having 3 main cues for each exercise to start off with. So what are the 3 essential cues you're going to start off with? Give those to participants, see how they're doing with that, and then have some follow-up feedback as needed. But then also having some backup explanations. So some participants might not quite click with the way you're explaining something. So have a few different ways of explaining an exercise, and hopefully that will click with the participants. Now, Julia will speak to the nuance of knowing how and when to call out specific participants and if that's appropriate, and when it might be appropriate. But in terms of the online setting, it's really harder to discreetly give feedback. So remember, try just addressing the whole group as opposed to one person, unless they've asked for personal feedback. You can chat with a participant before and after class again. And then if you want to use this chat as well on Zoom, that's an option as well. And then we have our demos. So making sure that our visual cues and aids are excellent. So camera setup has to be great, making sure you have good lighting so participants can see you. This isn't really much different from when you're demonstrating in person, but making sure you're showing from different views. So from the front and from the side, and then deciding how much you're demonstrating. So the way that we run our classes, we have 3 circuits and each circuit is done 2 or 3 times. So maybe for that first round of the circuit, you're demonstrating the whole time and relying on your moderator to watch for safety and help with cueing as needed, because participants will really be relying on those visual cues. I know there was a maintenance group that, they've been doing these maintenance classes for years, and they still really like having instructors show the exercise for the whole time. And finally, I just want to mention the value of these online programs. So it sounds like a lot of additional work. There's some new skills to be learned for both instructors and participants, but we're really reducing barriers to exercise for a lot of people. So those living rurally, those that might be living in the city, but they don't want to travel to an exercise class. Maybe there's those that are babysitting their grandkids that can't get away, or those who are too self-conscious to work out in person. So we're reducing barriers to exercise by allowing people to join a safe and effective program from their own homes. And this is really highlighted in the quote that I have here from one of our Excel participants. So she was saying that the program has provided a lifeline for her. So this highlights how online programs, which we potentially naively initially thought were just a solution to a short-term problem with the pandemic, are actually a really important resource for those living with and beyond cancer who want to access exercise oncology programs.
Cool. Yeah, and not only access, I was going to ask you too about, shifting to a virtual format. A lot of our programs kind of use that group format in person. So, and that kind of creates that sense of social support. Do you find that challenging to try and foster that same social support in a virtual setting? How does that kind of manifest from a CEP's perspective?
Yeah, it's really hard. It's awkward. But again, we just kind of have to persevere with it, and we have to come up with creative solutions. So along with the exercise that we deliver in our classes, we offer additional workshops for our participants. So it's an opportunity for them to gather together, have conversations amongst themselves about, different topics like goal setting. So they're setting goals together. And again, not just focusing on, we're here for exercise, let's just get in, get out, having that class time before and after to facilitate discussion about, I talk about the weather a lot. It's a great thing to talk about, and it does help facilitate conversations. So it is a challenge, but it's something that we have worked on and that participants have really appreciated in the online programs.
Cool. Awesome. Well, thank you. And that actually might segue pretty well into our last topic, and that is Julia. So Julia, take it away.
Thanks, Chad, and hi, everyone. My name is Julia Dawn, and I am a PhD student and clinical exercise physiologist with the Health and Wellness Lab. I have been in the Health and Wellness Lab for almost 8 years now, having started back in my undergrad. Also, just like you as a volunteer, I wasn't part of the initial volunteer training, but across my graduate studies, I have been coordinating the Thrive Center, so onboarding our new volunteers, and I'm coordinating the ACE Neuro, our neuro-oncology study, which has started running this year as well. One of my biggest passions across this work is supporting participants with lifelong movement, finding ways, looking at some of the psychology behind it to figure out how can we support participants the best way in classes. So when they leave, they think, okay, I'm going to apply these strategies into my daily life, and I cannot wait to come back next week. And we do that by creating a positive motivational climate. So I'm going to be talking, kind of pulling in together everything you've just heard from our amazing CEPs in the lab and how we do this with an exercise and educate framework. And I'm going to leave you with 4 tips for today, and I'll dive into each one of them. And those are to build self-confidence. So how can we support participants with their self-confidence, provide tools for successful behavior change, ask for feedback, and then finding the balance between correcting form and empowering participants. It's so much more than just exercise delivery, and thinking of ways that we can really support participants through their time with us. So for the first one, building self-confidence, if you can go to the next slide, Chad. Amazing. You may have heard this term self-efficacy, and in health psychology, that means self-confidence. So we know that when we can build someone's self-efficacy or their confidence, our evidence shows that can actually increase their exercise adherence and maintenance over time. So if we can really help to support participants so they can see themselves as exercisers, that can support their long-term maintenance, which extends beyond a 60-minute exercise class or a 12-week exercise program, but extend into their lifelong movement. And one way to do that is to provide specific and meaningful feedback. So absolutely saying things like, great job in class today, and keeping that feedback generic. There is a time and place for that. But where we see the magic happen, where we can really start to build that confidence for participants, is when we get specific and meaningful. So for example, let's say we have a participant, his name is Felix, and we notice that this week he's working with 5-pound weights. And last week he was working on bodyweight squats, going, hey, Felix, I noticed that you're using weights today for your squat. That is amazing. I can really see your strength improving. Boom, that's specific, it's meaningful, and hopefully that's going to increase his self-confidence and make him think, yeah, I am building my strength. And that can extend beyond the class as well. So thinking of ways that you can really make this meaningful, and like Jess was saying, centered to the participant. So next slide, please, Chad, if you can. The next tip I have for you is providing tools for successful behavior change. So in your practice, in your work with participants and clients, thinking of ways that you can include education into your exercise, so that there's that exercise and educate framework that we like to work with. And that can come in the form of something like an education topic. So goal setting at the start of a program, checking in on those goals halfway through, chatting different ways for barrier management, tracking progress. But it can also come in a simple format of simply, and this is from, I can't take the credit for this. This is Dr. Nicole Struthers, who taught us this years and years ago, but it can be as simple as starting off a class and saying, welcome, happy Thursday. Before we get started, take a moment and think about what brought you to class today. What is your reason for choosing to move your body? That can come at the start of class, at the end of class, and doing these simple check-ins can be really, really powerful and a way to support that behavior change. Some other examples of this include celebrating the wins and encouraging participants to reward themselves for a job well done. Oftentimes we have participants show up to the Zoom class or in-person class, and they say things like, I am so fatigued today. This is the last thing I wanted to do. Well, there is your moment to go, you came to class. That's amazing. You're fatigued. You came here. That's fantastic. Celebrate those wins with them and encourage them to celebrate them with their friends, with their family members, whether they're big or small wins. That can be a really powerful tool to support them in their behavior change over time. Next slide, please, Chad. The next piece is to ask for feedback. So being open-minded to improve ourselves as clinical exercise physiologists, exercise specialists, people working with this population is really important so that we can enhance their participant experiences. So if we have 60 minutes with a participant or in an exercise class, what is that 60 minutes going to look like? What can we do to make that an exceptional experience so that participants leave feeling, wow, that was awesome, and I can't wait to come back. So being open to receiving feedback from your participants, but then also taking the time to reflect on your classes. So how did that go? What could I do next time that would be better? Or what did I do today that was really, really good and I want to continue doing? As Juliana mentioned, taking that time before and after class, we always have 15 minutes before, 15 minutes after, so we can open up that opportunity for feedback, connection, reflection, connecting with the moderator after, and thinking of ways that we can really make this a great experience. One example I have for you on this is in the virtual world, of course, we have to deal with a number of different accessibility concerns or considerations, I should say. And oftentimes for some people, it might not be easy to hear what the instructor is saying or see, or maybe their setup isn't ideal. So thinking of ways that you can adjust your setup, adjust your workflow, adjust the way your moderator and instructor work together to support that accessibility can be huge. And thinking outside the box, do what you need to do to make this a great experience. Next one here. The last one I want to leave you with today, and this is what Juliana was alluding to, and finding that balance between correcting form and empowering patients. So absolutely, safety is at the forefront of our mind. It's our number one consideration. We need to make sure that participants are safe in their movement, that we've screened them like Tanya was talking about at the beginning of the session. But we also want them to leave class feeling empowered, feeling confident, and feeling like they can continue to move outside of class. And so as an example, when we are correcting form or providing feedback in class, it's really important to remember that let's take our participant Felix again as an example. If I'm correcting his squat, for example, or a specific exercise he's doing, and I just keep giving him cues over and over and over again, it's 60-second exercise that we're doing, and I've spent that entire 60 seconds correcting his form. that he may not leave class feeling like, wow, I can do this. I can do a squat. I feel good. He may leave feeling like, oh my gosh, I cannot do this. I can't do a squat. I don't feel empowered. I don't feel confident to do this movement. And when you work one-on-one with a participant, it's a little bit of a different format because you have more time, more opportunity for that one-on-one feedback, more time to tap into the specifics of how people's bodies move. But especially if it's in a group setting and online, when everybody is hearing that feedback coming through, it's really important to find that balance. As an example, give one or two cues at the start of your exercise, and then circle back to it on the next set or next class and say, hey, I'm really noticing that you're doing a great job relaxing those shoulders down and back from your ears. So circling back to it and again, making it specific and thinking of how you can empower the participant at the end of that session. At the end of the day, we want to encourage lifelong movement. Again, what can we do in that 60 minutes or in that 12-week exercise program that's going to translate to their daily lives? What skills and strategies can we support these participants with that will allow them to see themselves as exercisers, to build their self-confidence and encourage that adherence and movement over time? How can they move more? We have a few take-home messages for you today, pulling everything back together before we go into some Q&A. As Tanya talked about today, ongoing screening and communication really is part of building that foundation for safe and effective exercise. Continue to individualize and modify as you go and stay within your scope of practice. Know what your scope is as a CEP, as an exercise specialist, and working within what your scope has. Building a strong foundation is absolutely imperative when it comes to core exercises or any exercise that you prescribe. Keep it simple and focus on what's important before adding on the other pieces of what we might consider to be fancy. Using a participant-centered approach, everything is centered around the participant, like Jessica was alluding to. It's about them. It's not about us. We're there to support them. So what can we do for them? What is it that they need? And what support can we give them? And then there's a number of considerations that we need to take into account when we're online. Additional safety protocols, building trust with communication, and being creative in how we communicate, understanding that not everybody communicates the same way, and finding ways that work for each person. And then lastly, it's really important to create a positive motivational climate for our participants to support their lifelong movement, to allow them to build their self-confidence. There's no one way to move our bodies. There's no right or wrong. There's a continuum, and it's going to be a little bit different for everybody. There's no such thing as a bad exerciser or a good exerciser. It's about finding what works for that person and supporting them so that they can continue to move their bodies over time.